Finger joint replacement surgery depends on which joint's affected. So the knuckle joints can be affected, which are the big ones on the back of the hand that you can see. We refer to those as the metacarpophalangeal joints, but in layman's terms, the metacarpophalangeal joints are your knuckles. And then you have the smaller finger joints, which are in between the knuckle joints and the fingertips, of which you have the middle ones and you have the distal ones, which are right at the end. And various conditions can affect those joints, whether you're a sportsman or an athlete, or whether you're a musician, or whether you're a painter, or whether you're an HGV driver. You can fall and you can break them. And if they fracture, which is the medical term for that, then you have to treat them with a specific method. Either that's a wire or a screw or a plate. So that's one particular reason to operate those joints, falling under the trauma chapter. But then you have those who develop arthritis. Okay, so arthritis is a gradual degeneration of the layer between the joint. That layer is called cartilage, and it can affect your knee, it can affect your hip, it can affect your shoulder, but it can also affect your knuckle joints and the middle joints. And the middle joints we refer to as the proximal interphalangeal joints. Once that cartilage buffer runs down, patients start to develop pain and they start to develop stiffness. And the classic symptom is they wake up and they have painful joints and they have difficulty in actually moving them. And gradually that warms up during the morning hours, or they'll put it under the warm tap, or they'll put a glove on and they feel better, or they'll take a paracetamol or take a Voltaren, and that can also make them feel better. As years go on, or as time progresses, that doesn't work anymore, in which case you have to think of more invasive procedures, which can consist of an injection. So you put a tiny little needle into the joint and you inject some steroid, and that can reduce the symptoms by reducing the swelling and the pain. But that doesn't cure the arthritis. That's a temporary relief because it doesn't regenerate the buffer, the cartilage. It just reduces the swelling of arthritis. If that fails, then another option is potentially a splint. So you can see a physiotherapist and they could put a little splint on. But splints you can't wear all day. You can't wear them all during certain activities, so they can be a bit cumbersome. In which case you will have to consult me for possibly an operation, which could consist of replacing the joint or fusing the joint. So those are the two options for small finger joint arthritis. You can replace the joints, and we have some very fancy models on the market. We have some various prostheses that we can use. Most people have heard of knee replacements and hip replacements, but they don't realize you can actually have a finger joint replacement, and they work very well. Some are purely metal, some are purely plastic, and some are rubber, silicone. And the aim using those prostheses is to take away the diseased joint that's destroyed by the arthritis and put in a new tiny joint. And that allows them to move their joints without any pain. If, however, the joint is not feasible to replace with one of those implants, then you'll consider fusing the joints. Fusing the joints has an advantage of eliminating pain pretty rapidly, but it has a slight disadvantage that you cannot bend the joint anymore. So the classic rugby player who would come to my office, who's fractured their joint a few months ago because they always ignore the symptom, they want a strong, pain-free hand to be able to grip the ball. I wouldn't consider replacing that joint for them. I'd probably fuse it, and that will get them back on the pitch quicker and without any pain. And fusion can be done with a screw or with a wire, and there are various ways of performing that in finger joint surgery.